Hello, everybody. No sleeping today, okay?
Good.
Because before we had some sleepers, remember? The last time when I was here, I promised you to bring something. This is the exercise program for stretching. And certain neurological issues, such as Parkinson's, just like you eat every day, you stretch every day. I know that the day it's not long enough for everything that you have to do, but this type of stretching you can do while you're watching TV, eating, having conversation, whatever. What muscles? Oh, I'm going to quiz you right now. What muscles are going to get tight with Parkinson's? Since you were my first one waving the hand, what muscles?
Your latissimus dorsi. The back.
Actually, this one is going to get elongated, not tight.
Okay.
Anybody else? What muscles are going to get tight? Point to me. Elvis the pelvis. Did I mention? Did you hear me saying this before? Elvis the pelvis. What's happened to your pelvis? Goes back. What's happened to me now? I'm falling backwards. So today's speech is about falling. I cannot stretch enough how the stretching is important for you guys every single day. Here you have some explanations, and this is going to be available for you later on. And here you have everything. Starts with the ankles, going with your hamstrings. So when your pelvis goes back, what's happened to those muscles? They are getting tight too. And now the gravity is pulling you back. So what some of you are doing, instead of fixing Elvis the pelvis and your hamstrings,
I'm listening.
you are putting your head forward and shoulders. Looks familiar? I'm not going to point any fingers. So again, pelvis has to be fixed, and you have absolutely everything. This is the Elvis the pelvis. All of us, we would like to slouch. Again, I'm not going to point any fingers. All right. Oh, the same here. Slouching, it's a killer for you because those muscles, those back muscles are going to get shorter. And I'm sorry, but gravity is stronger than any of us, all us together. We still cannot fight gravity. Then you have the back. This is kind of how you're supposed to be when you would like to stand up. How many of you can be that straight? So you have absolutely, everything. When you are sitting a lot, those muscles here are going shorter too. So again, your pelvis is going to be over there. You would like to take a bigger step. Everybody says, take bigger steps. You can't, because if you don't have enough muscle length, you are not going to have good performance. How many of you going to bed when you are putting one leg at the time versus when you move two legs in the same time to bed? I know that some of you are doing this. Thank you for admitting. So again, if those muscles, inner part is going to be tight, this is why you cannot do it. There's nothing to do. You probably are still strong enough. Again, just the muscle tightness. Imagine if my pants are here, I cannot move my leg. So this is another example how to stretch your muscles to be able to get in and out of the car and in and out of bed, and possibly prevent falling when you have to take the step to the side. Trunk, this is another cause of falling, and we are going to talk about this. How many of you can just stand and not turning your hips? The hips don't move, but how many of you can turn your body? Check it out at home. This is fall prevention as well. So we have for the trunk, we have for the neck, we have absolutely everything. You do not have to do this at once, everything. You can do, okay, maybe when I'm in bed, I'm going to do, 2 or 3 of those. Those are timely because you have to hold. There's no pushing, there's no nothing. You put your limb in a position that you would like to stretch, not like this, obviously, but oh, I can feel it. Please do not do any bouncing. You can apply gentle pressure, but just gentle pressure. and do not compensate. Oh, I'm leaning forward. No, you don't. You just bend forward here in your chest, nothing to do. Now I'm leaning forward because my back is straight. So this I recommend if you know that you have a problem. And how do you know that you have a problem? We talk about this too, but just briefly, I'm going to review it. I'm going to sneak this chair for demonstrations. No shoes. No, now keep your shoes, but this is just for demonstration. If you can put your toes and knees in one straight line, means that your ankles are good. Don't do this with the shoes because some of your shoes, they have a higher heel than the toes and you think that you are good. You are not good. So again, this is kind of how you're supposed to be. If your heels are up, you have to do the stretching, and on page 1, you have what to do for your ankle. This is the biggest tendon. Will need some time to work. Usually after 2 or 3 weeks, you are going to see difference. It's not going to happen because you did 2 or 3 times. So toes like this, good. Now, how do you know that your hamstrings are tight? If you sit like this, do you see me how I'm sitting? This is how majority of us, as we're getting older, is sitting. This is poor sitting. If you are sitting like this and you can place the other chair, put your leg up and you are not dipping, or if your knee is bent, means that you need to do stretching because those muscles are necessary for walking and fall prevention. When you are lying down, can you lie down on your belly? How many of you practicing lying down on the belly? Not many. This is a very good for stretch. But again, when I'm standing, I can have my hands on the counter. And again, only leg it's moving, not the pelvis. If I can move it back, I'm good. Well, how about now? What do you think now? Do I have a movement in my leg? No, I'm moving my trunk. My leg goes because my body moves. Can I do this? All right. How about can I do this? Yes, I can. Or I go only up to here and then you are in trouble. When you are lying down, can you bend your knees and open your legs? Or you just open like this? This is kind of what you have to look for it to know, do I have enough muscle length? Because honestly, majority of the falls comes from decreased range of motion. And some of you, maybe you will need a little bit more digging, not only stretching, but like this part and this part, you cannot kind of stretch by yourself. It's difficult. Sometimes you will need a therapy. But when you are going to go to the physical therapist, ask for joint mobilization. Fancy name, but your joints needs a little bit attention. Because each bone, when we have 2 bones, they are surrounded by a sock, that everything is, that the fluid will be over there. There are some ligaments, there are some different stuff. Not only muscles are going to be tight, especially here. This is this big wing, the scapula on the back can be stuck, and you can try to practice and work on the strengthening. It's not going to happen. If you cannot go like this, means that you need a little bit more intervention. So you just have to know what to ask when you are going to go to outpatient, that you are not going to say, you know what? This is what I see most often. Isabella, I want to work on my balance. You see me? There's no way that I can work on somebody like this in balance. Alignment, body alignment, it's the cost of falls. So if you don't have enough body alignment, sooner or later you are going to fall. Doesn't matter if you are, recently, a few weeks ago or month, whatever, I went, with my friend to the gym and I was working as other people are working. Oh, they were working their butts off. All of them like this on the treadmill, on the bike. This is not the way how to do the exercises. So Very, very, very important. This is something that you should, like I said, you eat 3 times a day, you do your stretching 3 times a day. It's a boring activity, so it's a good thing. You can do more than one stretching, you know, at the time. You can work on this, you can work on leg. Use your time sufficiently. And some of you are great. Maybe you don't need the stretching, but right now I can pull like 10 people that yes, you do without even touching you. Okay. One more thing that it's not here, but I see this often. How many of you, especially men, again, I'm not going to point, how often are you sitting in this position? All right. Okay. When you are sitting time, time to time like this, be sure that you are going to go also and work with those hips here. Because when you will have a habit of sitting like this or sitting like this, what's happened to your hip alignment? Now you try to stand up and you are trying to use those muscles for standing. Those muscles are not equipped to stand. Those muscles are. So again, even Stephen, when your legs are even, now you are going to use those muscles. Those are going to help a little bit, but you see a little bit jelly belly here because they work just a little bit. This is what it's working. So hip position. Why also are hip position important? Because with Parkinson, we know that those muscles are going to get tighter when you are also toeing out. Now you are going to trip over your own feet. So again, be aware. Some of you, so this is about the range of motion and alignment. Do you have any questions about this? Yes, sir. For quads, yes, when you feel, for example, when I'm sitting and I feel tightness, it's like, oh man, the best position is going to be on your belly or on your side. I'm not going to say, this because this is kind of, a lot of challenging and not many people can do this when you have a problem. But when you are lying down on the side or in front, you can put a belt over your foot. And now you are going to, because you don't want to have this. You would like to have this. So when you are on your side, be sure. And sometimes you don't have enough range of motion. If I don't, I cannot touch my leg. This is when you have some belt put over your foot and now you can stretch. Yes. Any other questions about the range of motion and stretching? Yes, ma'am. If it's, okay, with the hip replacement, most likely, Michael, don't sleep. I got you. Okay, Michael is going to clean up after the party. And put your knees together. Thank you. You too. Yes, all of you. While you are working with me, okay, put your feet apart and bring your knees in. Especially those, those nuddy ones, because now you are stretching those muscles that are in the hip. You are not stretching the foot or anything else. Feet apart, and this is in. For the hip replacement, this is depending on the surgeon. Each surgery is different. You have to talk, how long ago did you have? Usually the precautions are going to be for 2 months, sometimes 6 months. Sometimes the surgeon is going to say, you know what? You should avoid bending and bringing the leg for the rest of your life because it was complicated and the socket, it's not exact, it's a little bit off. I had to do modification. So I cannot give you clear answer. If you are 10 years and you didn't have a problem, this shouldn't hurt you at all. At all. Because again, we are not doing some, extreme position, like putting your leg behind your neck, you should be fine. But if it's fresh injury, then you have to talk to somebody. The same with the spine. If you have a rod in your spine, there is something over there that you are going to do like this, you may not be able to do it. There is something here to stretch the rib cage, but also involves the spine. You may not be able to do this. If you had only kyphoplasty or, 1 or 2 vertebrae, you should be fine. So just be careful with those. Maybe instead of do gradually, instead of pulling yourself all the way, you see how I'm doing? Most of the people, they just put their hands and they think that they're good. No, the shoulder, you see, I really, I'm pulling myself with this hand. And now I can feel the stretching. Each of you is different. So I'm not going to tell you how much you have to pull yourself. Each of you have different diagnosis. But when you are sitting like this, it's not going to work. When you work on your core, you have to sit like this. When you work on your neck, there is some exercises here. Put your ear to your shoulder. Guess what? When your head is like this, look how much I can go. I cannot go. How about going to the side? Look at me now. I can go all the way. Because again, so the first thing when you are going to work on the neck, you are going to take your head and you are going to push it back. Or if you have a helper, the helper is going to stand. May I show something on you? Is your neck okay?
So, yeah.
I will stand behind her and I'm just going to, not now, just to show you, relax your head and push it back. That's it. Now you can work on moving your head, stretching this and stretching the other way. Otherwise, it's not going to work. Actually, it's going to hurt you because each vertebrae, it's not just round block, has little sticky things, sometimes on the side, sometimes on the back. And when they're already, all crumbled on the top of each other, this is why you also cannot have the range of motion of the neck. So double chin, if you have double, do the triple. So the face doesn't change. The face doesn't go up. The face doesn't go down. You are just moving your head from here to here. Maybe it doesn't look pretty. When you are driving a car, there is a red light. Boom. Do the stretching work on your neck. Voila. This is already something to taking care of it. Okay. So did I answer your question? It's because all of this is kind of not going out of any like limits. You have to be able to move your leg just a little bit. You do not have to go all the way. Well, actually, I cannot go. That's it. This is the joint. I cannot go higher than that because this is the joint, how it's built. The same going to the side. That's it. I cannot go anymore. Don't do this. This is cheating. Imagine wall in front of you. Okay, you can hold yourself. Can I do this? No, I can't. I can go only here. Then you know that you have to work on it. When you are going to do this, please don't do this on open areas, in standing. Always have something that you are going to grab to it. And guys, I'm very serious. This and your body alignment is the most important thing to prevent falls. Because if you are going to get tighter, it's like walking in the cast. It's not going to work. And if you have to do fall prevention, it's not going to happen. You are, right away on the ground. So range of motion, we did. Strengthening, it's similar. If you can do sitting and you can move your leg, always start with stretching. Don't do strengthening. Work on stretching. This is your main principle. Just like, again, eating every day, you have to do this every single day. This is how you are going to get, maintain or getting better, whatever you have, and not getting worse. And trust me, I have a lot of experience and I know what I'm talking about. Strengthening. When I'm lying down, can I move my leg up and down? Again, it's not this because this is what I see very often. This is not aerobic class. You go up, hold, and then you go down and stop. Don't use momentum to move your limbs. Whatever you are going to do, slowly, there is a slow movement and later recalling. I see this too. It's useless because again, then you are just using momentum. You are not even using the full range of motion, whatever you have. If you can do 20 times and you can feel, I can feel it. How about if you cannot do 20 times because after 10, you are pooped? Means that you have to do it. If 20 times is easy and you do 2 or 3 sets, add some weights, add some bends. But again, everything slow. You can go to the Y, you can go to any gym. And again, whatever you are going to do, slowly and work on your posture. So whatever you are going to do, be sure that only, you see, only my arms are working right now. When I would like to pull or push, whatever, it's not doing this because this is not going to work for you. So you have to know muscles. For example, when I'm doing stretching here, I should go right away to strengthening on the opposite side, which is going to be my bottom. How do you work on your bottom? In lying down the best way, bend your knees, lift your hips. You do not have to go all the way because I know that some people have a problem, but just lift it and hold it. 1, 2, 3, and then go down. This is huge because again, this is going to help you with your pelvis. Pelvis, yes. Yes, you can do in the pool because you can go backwards with the pool. When you would like to work on your bottom, then you have to work backwards. And now you are working those muscles backwards without leaning forward. So yes, absolutely. Or you can just go and hold it, and go back. Absolutely. All the exercises for strengthening you can do in the pool. Are we good range of motion and strength? Kind of. You should know you have 3 joints in the legs. The hips can go up and down. And this way and this way. And pretty much that's it. The knee only goes one way. Goes this way and goes this way. You can do this in sitting, right? By just doing, leg up. But again, when you are tight here, why I would just go up to here. First, I'm going to do stretching here to gain some muscle length. And later, I'm going to do the strengthening for my leg. Make sense? The same for the ankles. When I'm pressing down because my ankle is weak, now I'm going to go move my feet and hold it. So stretching followed by strengthening. Use mirror because some of you, how do you know that your sensation is okay? Anybody did any sensation testing for you recently? No? All right. With Parkinson's, and not only, you may have a little bit loss of sensation as well. How do you test yourself if nobody is there? Get a Kleenex. Do we have a Kleenex in this house? Not yours, not yours. No, not used one. I'm going to show you something. I'm going to teach you how to screen yourself. Because then you will say, you may go to the doctor. Hopefully, sometimes you go to the doctor and you will say, you know what? Just one.
It's clean.
I don't know. I don't trust. No, kidding. Okay. Thank you. Yeah, got it. Kleenex is nice because it's light touch. This is what it's all about, light touch. So for example, when I do screening for again, I'm going to use you. The face is my reference point. Do you feel this? And I'm just going to use the end. Do you feel this? Is this and this the same? And now I'm going from the arm to the leg. Do you feel this? And now I'm going to go right away to toes and foot. I skip the middle part for now because sometimes, I will go, do you feel this? And do you feel this? Well, you didn't because you have a shoe.
Oh, good.
You have to do this without, Here and here feels the same or different. And sometimes people say, you know what? Below the ankle, I barely feel. Why this is important? Because when you are in community, the ground, it's not so even like it's here. The ground may be off. And if you have a sensation issues, there is a bunch of sensation. This also position joint. Sometimes people don't feel it. Okay, my elbow is straight right now. Is it straight? They feel that it's straight. And at this point, it's going to be, the same with the ankle. How do you know that your ankles goes up? Maybe in your mind, this is when your ankle is up. And when it's something uneven, it's a problem. So there are different type of sensation. We call this very fancy name proprioception, position on the joint in space. And if you don't feel it, and suddenly the ground, the road, it's not flat like this, it's at the angle, and you are walking this way, boom, and you are falling. So when you have issues like this, you always should kind of scan outside. Oh my gosh, I have to go over there, but this side slopes. This side, go over there whenever it's straight. Or if you absolutely have to go, then walk slower and keep your feet apart. Because if you're like really apart, if your feet are together and you are walking on the slope and you are already off, the gravity is going to get you. So this is another thing, fall prevention. Be sure that your station is okay. And if not, make the adjustments. Watch yourself. You can use the mirror too, because sometimes, you know, your posture didn't happen over 1 month. This is over years. And for you, this is normal. Well, is it normal for me? No, it's not. So look at yourself, take the picture. And, you know, sometimes I take pictures and videos of my patients because they argue with me that, no, I don't look like this. I'm still, you know, 6 feet tall. And I said, look, I'm 5'3", and your nose and my nose are on the same level. How you can be 6 feet? Because again, everything is cramming. They still think that there are 6 feet. So mirror, mirror on the wall, or pictures from front, from the side. It's like, oh, shoot, I have to improve this. Oh, my butt is in. This is the pelvis. This is the slouching. This is the hours in recliner, which I don't recommend. 1.5 hours for the movie, good, no problem. But when you are spending half of the day in the recliner, you are not doing yourself any favor. Those are the worst, okay? So the next thing about the fall prevention. So we have range of motion, strength, sensation, posture, the body alignment. This is crucial. When you have sensation problem, or your vestibular problem, you know, vestibular, it's responsible for the balance, right? So you may have a dizziness when you are rolling from the bed. This may not cause you much fall, but when you are going to bend suddenly, be careful of the head position. When you are picking up object from the floor, what are you going to do? You are not going to do this. Because guess what? I'm already there with the vestibular system. I'm getting dizzy. I'm going to go on my kisser. The best way for us, just, you know, bring this closer and do this from the sitting position. But even when you are going to pick up something from the sitting position, you have to do this. You see me? This, and then pick it up. Majority of my patients, what they do? Oh my gosh, I'm falling. Well, yes, of course that you are going to fall, because also you are moving too much of your body forward. You're supposed to just bend. Your bottom is still on the chair. When you are doing this, you are moving everything. So wide base of support, if you can do this from standing, squat, bend, and later pick it up. So my head, it's a little bit low, but my head, it's not down. So the head position, it's the fall prevention. I have a few patients that they had a fall from the bed. Why? Because when they're rolling in the bed, when they're getting up, they put the head down. I don't know why, but this is very common. So we are lying down in bed. I said, okay, let's get out of the bed. Can you roll? And they roll this way. Why would you roll this way? It's a still mystery to me. Your head's supposed to stay on the pillow. You're supposed to roll just this way. One of the things, if you don't have enough flexibility and range of motion, this is kind of, you know, you are using kind of like the momentum. And later you are getting up, your head is already out of the bed and people are falling. This happened, you know, I had a few people like this. They just don't know why they had a fall. I said, well, what's happened? and they got dizzy too because the head was down. So pay attention to your head. Next thing about how is your balance? So let's say that some of you have decent posture, the balance. How do you check if I have a good balance? Never do this in the open area, kitchen counter, something sturdy and maybe somebody with you. Can you stand? But you see, I have to stand. If I'm like this, it's not going to work. Can I stand on one leg and for how long? You can do this maybe at home with help. Please do not do this by yourself. And some of you have great. That on the back, lady on the back, with the bilateral hip, by the way, and how much I can stand on the other one. Can I do this, or I'm just doing this? Why this is important? As we walk, there is a moment that you are on one leg, isn't it? Yes, it is. How about when you have to step up the curb? Even you need longer time to step up on the curb. If you don't have this ability, this is why also later on, everything becomes like this. And you are just gliding over the surface. So how to improve this? You just have to know, okay, what do I have to do? Maybe I need the mirror. I have to move myself on one leg and then gradually just move a little bit. Okay, okay, okay. What's happened? Well, my body was pushing me. So nope, I have to stay on this side. Look at the mirror, look at yourself. Oh, okay, I can do this. The other thing that you can do at home, stepping, this is multi-directional stepping. Could be forward or could be over flat or obstacle. Can I go over the broom that I just put? Or I'm losing balance right away. Or maybe shoebox. Can I tap? Let's say that this is not that high, but little shoebox, whatever, book. Can I just tap it? Can I just tap it? Or I'm losing balance right away. Those are those exercises that you can do to improve a little bit your balance. Also, why people are falling? Because they lost ability to walk backwards. How many of you practicing just walking backwards? Okay, 1, 2. All right, next time I would like to see more hands up. Why? The walking backwards is going to improve your motor control. What the heck is motor control? So we have muscles, and there is one guy in your brain that is going to set up everything and tell the muscles, hey, when you walk forward, you bend your hip, you bend your knee, and now you move your foot. You hold this, you hold this, you hold this. So that all the muscles are kind of working together. They know what they have to do. I work majority with the stroke patients. This is my specialty. You don't want to be my patient, okay? But if something happens, you do. And then I may have sometimes muscle, strength, but if the motor control is off, the brain doesn't know what to do. So again, for you, improving motor control, walking backwards. But again, walking backwards, it's not this, because I see this very often. I said, can you walk backwards in the bars or along the kitchen counter? And they do this. This is not walking backwards. You have to have a nice alignment and your toes are going first. When we go forward, the heel goes down first, right? You probably heard about this. When you go back, the toes. And now just the toes and heel, toes and heel. Going forward, heel and toes. Your foot is rocking and you have to have this push off. When you have push off, you are going to improve your walking. If your foot doesn't go down, if it's not strong, you see me now? This is the thing. So you should kind of practice this too for walking forward, because now your body is going to go forward. As you walk, it's very easy for me to walk right now just based on the foot. Feet are very important, and I think that us as therapists, we don't spend enough time on it. We don't check the range of motion. Well, I do, but in general, Can you do this? Oh, good. Can you do this? Oh, good. We don't check the feet, and the ankles are carry your entire weight. So if they are going to be out of whack, you are going to be out of whack. Next, dizziness. Who has dizziness when you are getting up sometimes? All right. Do you have a blood pressure cuff? Wonderful. If you don't have a blood pressure cuff, please get a blood pressure cuff. Why? Because unfortunately with Parkinson's, you may experience some fluctuation of your blood pressure. For all of us, we have different blood pressure in lying down, sitting, and standing. The higher one, it's in lying down. The lowest one, it's in standing. And usually this is going to vary by, maybe 10 millimeters. These go from 120 to 110. Well, sometimes goes from 120 to 60. And then when you stand, you are going to collapse on the floor like a fly. So my advice, do some testing on your own a few times during the day, or maybe for a day or two. You are going to be very on it. And every 2 hours or 2 or 3, whatever, you are going to check your blood pressure in sitting, how it is, and later in standing. And especially when you have dizzy spells, this is kind of what you would like to do. If you have fluctuation of the blood pressure more than 20, yes, you may experience a little bit dizziness, okay? So very, very important to kind of detect this before you are going to have fall. So now I have a question. You have to go to the bathroom. You have to pee very bad. You stand up and you're dizzy. What you should do? A, go to the bathroom anyway. B, sit down, and even if you have to, I'm sorry, pee your pants, you are going to do this. What are you going to do? Sit, because there's less cost when you are, I had, again, from my experience, I had patients that they had to go to the bathroom because the bladder is weak. They stood up, they were dizzy, they went to the bathroom anyway, but guess what? They didn't make it. They peed their pants anyway on the floor with the broken hip and arm. You don't want to do this. You stand, you wait. Okay, do I still dizzy? Oh man, yes, I am. It's just like it's not clear. It's off. It's off. Sit down. Or after a few seconds, 5 seconds or so, okay, I'm all right. I'm good. Then you walk. Also, the lower blood pressure can give you sudden kind of like a weakness. You stand up, you feel kind of good, but you stand up, you're dizzy, so, oh my gosh, I'm so weak. Sit down, because this is kind of a warning sign. Sit down, or you are going to have a fall. So I should be on commission at Amazon. I can tell you this because I sent everybody to Amazon. Okay. Next thing, for falling, how many of you are sleeping with the little light? Okay, how many of you is sleeping when it's dark in the room, pitch black? Okay, either way, I didn't see hands, so I'm just going to go with the topic. Please keep little light, because again, with Parkinson's, and not unless we're getting older, we may get a little bit disoriented. When you have to go to the bathroom, again, you open your eyes, maybe you are dehydrated, and now you are confused because you didn't have any water, like I didn't have any water today, for example. I'm a very bad example, but only today, it's my day off, so I don't drink water, Yeah. Have a little light that you are going to have good orientation. Be sure that you can get out of bed easily. If you cannot get out of the bed, please get a bed rail. It's a little rail, goes under the mattress, that you have something to hold to it. Also, this bed rail, you can put little bag on it, that there are motor control, phone, water, that you don't have to reach over to the table to get whatever you need. So you have to kind of know, what assistive device you are going to use. Some of you are using walker. and I see that the walkers are too low because I know that they're too low. And you are walking like this. This is just influence your posture. And the reason is, well, my therapist told me that when I'm going to go higher, then I'm going to fall backwards. Probably, but again, this is like a, little thing to think. Oh, shoot. Instead of moving my walker, how about that my therapist is going to work on my body alignment and fix this? Is going to tell me to stretch that again, I'm going to improve my body. But cane, when do you walk with cane? With cane, you should walk when you have just slightly balance issues. When you stumble, maybe the cane is not something that you would like to use it. So we have the four-wheel walker, which I like for certain people. But when you start to walk with the four-wheel walker like this, please don't. Stop using this walker, get the regular two wheels, work on your alignment, work on your posture, and then go back to it. You are taking bomb for falling. And even on the parking lot the last time, yes, I saw this one. I said, oh my gosh, this is going to be my patient, because you are going to have a fall. So you have to know what device is good. Sometimes they have, probably you saw on TV, they have those walkers with the arms. I like those walkers for patients when they don't have hand control, if they cannot hold it. Or I like those walkers only for education about the posture. I don't like those walkers to use for people when they have hands all the time, because now your entire body is going to get out of whack. You are going to be weak because you have this platform that it's holding you, and your body doesn't have to work. But as an aid for postural education, oh, this is how I'm supposed to walk. Oh, okay, so you walk a little bit with this as an exercise, and later you go to regular walk. Okay, I would like to be the same, just I was with the other walker. So be careful with the four-wheel walker, because when I hear the advertisement on TV, oh, they're a miracle. I don't agree with this. And I had two people, when I removed the walker, they just collapsed. And again, this can be a risk of fall too, if you don't have a core strengthening and stability in your body. This is important. If this is out of whack, you are going to be out of whack. You are going to fall. This is why, I really concentrate on this part. If you are good here and even your legs are a little bit weaker, you will still function. But if your legs are weaker and your body is off, we are going to have a fall. Next, medication. Especially when you go, when you're at home, you have a certain regime of medication. You know your medication. You know when you have to take the meds. You know maybe what's happened when you are not going to take the meds on time, that they are going to mess you up. Then you go to the hospital. And this is totally different story. Because you go to the hospital and there is some, hot shot that they think, whatever, the doctor, there's no doctors here, so I'm not going to be, okay, but the doctor, the doctor said, oh no, let's give him, let's give him this, let's give him this, let's give him this. And now you're out of whack. Because your body, it's not, maybe very sensitive to changing of the medication. Then maybe you have more confusion, more stiffness, more this, more that. Be careful. So I know that sometimes fighting with physicians, it's tough, but you are your own, you have to fight for you. This is what works for me, and I don't want to change any of my Parkinson's medication right now. I have a neurologist outside. When I will be out, then I'm going to do whatever. Again, I'm not working for against the doctors by any means, but I'm just saying be careful, because I saw many patients when the medication were changed and they didn't do well. And then they come to us, and then we try to straight up everything with the family members and patients. And we are losing quite a few days of therapy. because they are, again, they are not themselves because the meds were changed. Some medications you shouldn't put together. Ask the pharmacist, hey, I have all those medications. In any of those meds are going to interfere with this. Oh yeah, don't take this and this, otherwise you are going to get, dizzy. Or this and this, oh, you may have diarrhea. Oh, this, or you have to kind of know what are the side effects of the medication. Drinking. I like mango martini myself. How about you? Well, I don't drink, but if I drink, mango martini is my thing to go. But drinking water. I basically, I have a student right now and her job to pass the course, kind of, it's to remind me to drink water. So 60 ounces. I don't like drinking and I should drink 60 ounces of water you should have a day. However, try not to drink too much after 6 o'clock. Why? Because later you are going to go to the bathroom during the night, and this could be another cause of fall. So drink during the day when it's time, 2 hours close to 3 hours, 4 hours to go to. Don't over drink because it's like, oh my gosh, I just had the 1 glass of water. Now I have to have 4 more. Doesn't work. Also be cautious about some food that can make you go to the bathroom. Watermelon, it's one of them. Grapes is the other one. You kind of have to know, what makes you go just to avoid this food when you are going to, close to the bedtime. What else? What else? Of course, I don't have to say, remove all the rugs from the bathroom and, the beautiful oriental rugs. Make when you walk with the walker, be sure that you have enough space that you are going to move this antique table because it's on your way, or you have a beautiful Persian rug in your dining area, but the corner it's sticking out and you have to go to the kitchen over. Guys, remove it because this is a hazard. Anything that it's hazard, please remove it. And this is kind of the case. And I can tell you what I do. I have patients, even recently, that they have an orthostatic hypotension. And we do trial and error. This is kind of how, when I see a patient, and let's say he's sitting, I check the blood pressure, it's low, whatever, 70/40. This is low. This is low. Let's be honest. And then like, okay, but there's no glaze on the face. I'm asking you, how are you feeling? I'm okay, But when I see glaze, I don't stand up with him because I know that he's going to plumb. And then we have a problem, broken bones. Hopefully only bones, not the neck. But what we do when he has a good day, I do sit to stand with people. I said, okay, we're going to start, I elevate his chair a little bit, that it's not as much strengthening. I get a big cushion. So he's already like this. I said, okay, we are going to stand up, hold 5 seconds or 10 seconds, sit down. And we are going to do a few times. I check the blood pressure. Most of the time, believe or not, is going to elevate a little bit. Then I said, okay, we are going to stand and we are just going to do a little bit of this. 30 seconds. How are you feeling? I'm feeling good. Okay, sit down. Stand up again. 30 seconds. How are you feeling? I'm feeling okay. Great. This is kind of, and later I exceed this to 1 minute. If they are 1 minute, they're not going to fall. Again, from my experience, they're not, if you can stand for 1 minute, most likely you are going to be okay. I have a lady friend that her blood pressure, it's again 80/60. Buy the book, buy the PD book. I shouldn't stand up, I shouldn't walk. This is her blood pressure that she can function and she's not falling. But sometimes she falls lower, to her 60s, and then it's like no go. This is why you have to have, this, again, if the physicians cannot figure out how to do, what to do, how to do, I cannot either. Because, this is just something that I don't know. Well, if they will know what is going on, they will fix it. This is just a mechanism that happens. And maybe one day somebody is going to, fix this. And I have this for I wouldn't say majority of Parkinson's, they have this problem. But 1/3 of my patients have a problem with the blood pressure and they're asymptomatic. What you have to do, you have to know, can I recognize those symptoms? I feel a little bit off. This is why the checking, okay, sitting and later standing. How is my blood pressure? Oh, shoot, moved by 20 points, but I'm still okay. All right, I'm going to stand a little bit more and I'm going to check myself after, 30 seconds. I'm a little bit off, but I'm not dizzy. I'm going to check myself again. Okay, bring it up a little bit. Means that your body, it's kind of, with the blood pressure, you have two guys, baroreceptors and chemoreceptors, whatever, two guys that are responsible for blood pressure. And as you are standing up, then they adjust the pipes, they are going, the blood vessels. They will adjust the diameter, and this is why, you are all good in the neighborhood. But if those guys are, again, out of whack, there is not much in the system that can regulate this, except maybe, the physical activity that when you are changing the position and in a way you adapt yourself. But again, recognition of severe drop. And when you have dizzy, and weakness in the same time, do not walk. You have to be kind of, limited, whatever you can do. I wish to have answer, but smarties, they don't. They will play with the meds sometimes. How about this? How about this? And this is something pharmacology maybe help. Because I know that one of the ladies that I know, they tried this and this and this and this. Finally, they found something that was working for her, that she didn't drop, like 60/30. Because this is like no go whatsoever. And sometimes the doctors say, hey, your blood pressure is 160, 170/100. Don't take the meds, just wait. Go and figure. They said, don't get this high blood pressure, but for her, it's okay. Each of you, it's okay. And this is what you have to talk to about this with your doctor. But be aware of orthostatic hypotension. Drops less than 20 can cause you dizziness and falling because you are just going to plumb like just go down. So what the gentleman said, that sometimes, from his experience, when you rush, when you are maybe in not familiar surroundings, that there is something, that can contribute to orthostatic hypotension. You see, each of you have different experience. This is why I think that you should, do you have like a support group that you can talk to each other? Hey, this happens to me. And you know what? I found out that this and this works. Maybe, when you are going to talk like this to each other, like we have a support group for stroke, and patients are talking to each other, families talking to each other, because sometimes, you may have a fun solution for something that he has or whatever that is going to work for somebody else. So questions and answers. Hey, I have a problem like this. Anybody else has it? Yes, I do. Did you do anything? Not a thing. But maybe she did. He said, you know what? Let me share my experience with you. Because this is kind of how we learn. And you have a very nice group right now that you could do this. Actually, you know what? If you know that well each other, do some stretching together. Do some body alignment. Prompt yourself when you are sitting here and eating. Hey, how do you sit? Hey, put your foot down, put your leg down. This is kind of how this can work, because you try to create habit. For habit takes 2-3 weeks to get somewhere. So when you have some people, you see, when I do my stuff, I do little group time to time. And I said, okay, do you see Gary? Yeah. Gary's head is to the left. What's happened to Gary when he stands? He falls. He falls. So all of the people, the remaining in the group, like 3 or 4 people, whenever they see Gary, Gary, head to the right. Guess what? Right now, Gary, you just say Gary, and Gary is keeping the head straight. But this took us, over 2 weeks because he was like this, guys. Now he's a little bit better, but before when I said, Gary, move your head, nothing happened. And now, I did massage, I did stretching, I did manipulation, I did whatever I could from my end, strengthening, whatever. But now, other people, hey, don't do this. Hey, don't do this. And, and Gary straight is smile on the face. So, of course, I have their permission to prompt them. I don't do this without the permission. And, but, you are with you for quite a bit. Even when you are doing something, you have a break. Okay, hey, guys, let's work on the, on the pelvis. Put your hands on both of your legs and arch on your knees and arch your lower back. Arch your lower back and double chin. You can do this. Nothing stops you. Bring your knees in. I can see you. Not feet. Not feet, knees. Yes. Just like this kind of, Okay, so now what I'm doing, I'm working on Elvis the pelvis. I'm working maybe on my neck because it's double chin. I'm working on my hips. Elvis the pelvis, shoulders back. I'm doing 5 things in the same time. And then you kind of relax, you hold this. Don't hold just for a second or 2 because it's not going to work. But your job, it's to move the damn pelvis from here, you see me, to here. This is your job. This is your job. Because when you are getting up, you see, when I'm like this, okay, even when I'm going to put my feet here, can I get up? No, I can't. 2/3 sits on your pelvis. If your pelvis is back and a lot of body is back, this is why I have to do this. Oh, now it's easy. I don't have to move your head up because the head doesn't go down. The head is moving with my trunk. I do not do this. I said, lean forward. Okay, this is not leaning forward. And now you can also not take a breath. So you are squeezing your breathing box. Now you cannot breathe. Now you can make dizzy. Because when you are holding your breath, you also are working a little bit with your blood pressure, right? Yep, I know. So again, open this. Open, come on, open this. Oh, I'm going to open for you. Yes, just like this. Imagine that something is pulling you here. Remember the tight jeans? What do you have to do to zip them? You had to do this to keep this straight. Otherwise, forget about zipping the jeans. You cannot do it. I use a lot of analogies, like for example, sit to stand is just like the song, head, shoulders, knees, and toes. Do you know this song? So just remember the song, head, shoulders, knees, and toes. Why? Knees and toes, head, shoulders. Voila, this is your position when you would like to get up. Do this. Whoever doesn't have a bad knees, move your feet back. Shoo, shoo, shoo. Knees and toes in one line. Guys, this is not one line. Look at my toes. This is not a straight line. This is a straight line. So move your feet back. All of you, and feet apart, because always keep the feet apart. So this is very important to know what I'm saying about straight. I need a cane. Thank you. So this is a straight line. This is not a straight line. Well, keep your, scoot your bottom first, because bottom always go first. You have only one butt. This is why the bottom has to go first. Now, is this a straight line between your knees and toes? No, move them back. Feet apart. Keep the heel down. So you have to do stretching of your ankles, sir. Almost, but not there yet. Okay, now we'll be good. What do you think about this, guys? No go. This is the straight line. The knees and toes, they have to be aligned. This one will be probably better. Almost, not there yet. More. Thank you. What do you feel? Feels awkward? No? Okay. Michael, you better don't disappoint me. Move your toes back. More, 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 more. Holy moly. Okay. Now we are home. Now we are home. All right. Not so much. So this is kind of, you have to be, guys, aware of it.
Your toes are back, your heels off the ground.
This is why I said check, because maybe your ankles need some stretching. So maybe you need some blondie that is going to sit on your lap and stretch your ankles. You have this in the exercise program. You can get a book, just get a book, you know. I like Webster Dictionary because nobody is using, everything is on the phone. So it's a good because it's a hardcover book. Put 1/3 of your foot on the book. Do this in sitting, do this in sitting, 1/3 of the foot on the book. And now press down here, or again, have a blondie to sit on your lap. And now you are going to push it. The other way, you are going to have, you know, I have the other exercise with the gait belt, but you can get the stretch strap. Amazon stretch out strap. Comes with some loops, is green, or, you know, and then you are going to put again, let's say that this is my strap. I'm putting over the, I'm going to break it and he's going to kill me. He's not here. Oh, thank God. Okay. And then 1/3 of the foot, and now you're pulling. Please don't do this with the straight leg. When you work on the ankle, always keep your knee bent. The reason is that when you are doing this, those muscles are tight. You are not going to get the same results for this. Can you do this? Yes, but you are doing this for hamstrings, not for the ankle. So when you are working on the ankle like this, or just like, you know, even right now, I can push it down. I can do this in standing too, but you see, I'm doing this. I'm not doing. Now I can feel more here. Now I can feel in my ankle. And I'm glad that you asked this because this is exactly what I do the self-assessment, how your legs are working. Do I have enough range of motion in my heels? Because if you don't, I don't want for anybody, let's be clear, I don't want for anybody to stand while you have aligned knees and toes, but your heels are up. This is a mistake. If your heels just slightly off, they are going to go down. This is why you have to do this. And nobody's going to do it for you. All of you, you have to do this by yourself. It's going to take you a while, but you know, the goal is, you see, I can move my heels even more. You see, I'm right now this way. I'm good. Whew, for now. But you know, this is the minimum. And if they're up, you have to work on it. Because if I'm going to put my flat feet here because I don't have a range of motion in my ankles, the same problem. Okay, shoot, I cannot get up. Well, of course you cannot get up. This is the base of support for you. And now you are going to have a fall because you are falling. If this is a toilet, what is behind the toilet? A wall. And then you are falling and you're going and boom, we have a brain injury. Not my team. You are going to go to red. I gave them the page. They can make copies and they can give it to you. I just didn't have time to make copies. I'm like up to wazoo. I don't know if they're making copies right now, but they have the original one that I gave it to them. How about that? They will have copies available by tomorrow.
Yeah.
Stretch out strap. Yes, stretch out strap. And those are nice. They come in different colors. Green, it's for normal people. What I'm saying, normal height, average height. If you are tall, like my husband got himself a black one, black or navy blue, because it's longer. Then it comes also with some book for stretching, so you can kind of utilize this too. But it's great because has some loops along that you can hold it. It's very easy to handle. I better give the cane back. Oh, the cane, also what the cane is good for? Absolutely nothing. There's a song, right? Okay. Good luck with your shoulders. When your shoulders are like this, you will not be able to do this. Broom will be more appropriate because it's longer. Okay. No. Whatever you feel. Again, I don't know anything about you, so I cannot tell you what to use. But I think that if you are using this cane, maybe one notch higher will be better. I think so. But again, don't quote me because later I don't want to. Isabella said so, and now I had a fall. I don't want to see this, but you may try one notch because your arm, when you walk, the walker, the cane should be when you are like this, the elbow should be a little bit bent because when you are going forward, now you straighten the arm. If the cane is too low, then you are doing this. All right, thank you very much. Oh my gosh, is that late? You're very welcome.